everybody, it's Dr. Sanders here again with another tip of the week of having pain here. This is what you can do at home. Any of you out there having or struggling with some pain that could be knee, but also could be lower leg on the back, but also could be at the bottom of the foot, kind of towards the ankle, or it may feel like it switches, or you may just have pain on the bottom of your foot, but more towards the heel, and you may think it's plantar fasciitis, or been diagnosed with plantar fasciitis, but the inserts, the massages, the foot massages, and the different shoes or orthotics just aren't cutting it. Or, like I said, having weird knee pain where braces and exercises and working on the upper leg doesn't seem to be causing the effect. Well, you could be getting referral pain from another muscle in the lower leg, and this muscle is the gastrocnemius. And the gastrocnemius, it has a cool muscle, and it functions very differently than other muscles in the body. It crosses two joints on where it starts and where it ends. It starts on the back of the upper leg bone, and then crosses the knee joint on the back, and then crosses the ankle joint and inserts on the ankle bone or calcaneus. And it helps for doing what's called dorsiflexions, or motions of getting up on your toes. A lot of times this muscle is used a lot in our bodies. And particularly those individuals who participate in events where they're up on their feet and have to push off on their feet on various things. It could just be merely just standing. If there's actually poor foot mechanics, or foot support or foot activation muscles in the bottom of the foot, the body will recruit the calf muscle or gastrocnemius muscle to help support the ankle. So a lot of patients who are having to stand all day with these poor mechanics or poor footwear or standing on hard surfaces can also cause this muscle to fatigue and to overwork. Definitely those who are jumping or having to be up on their toes, particularly the high heels, can sometimes be a culprit or cause this muscle to overwork. Now, there's a lot of things you can do with this muscle at home. I'm going to show you a simple one today, used with a lacrosse ball. And the way we do this one is gastroc is kind of up in this area here, and it kind of comes once again to the back of behind the knee. We're going to work this area of the muscle. It has two sections of outside or lateral head and an inside or medial head. And we want to work both of those sections. So basically what you do, you come along, point your toes, put the ball down beneath the muscle, pointing your toes like this. Take the opposite foot, put it on top of the leg, and then simply point the toes toward your head. And this is the toe of the leg that's on the ground where the ball is touching. And you can kind of move it back and forth. And then what you do is you move the ball up, pick a different spot, start with the ball pointed, put the leg on top where that ball is roughly, and you can apply as much pressure as you feel you need, and then simply then point the toe towards your head. Again, it's the leg that the ball is pressed against. And you systematically work all the way up, both sides. It should only take you about 30 seconds to a minute to work all the muscle. And be gentle, this muscle can be quite sensitive. But for active symptoms in the ankle, foot, or even lower leg or knee, I would recommend working it like 3 or 4 times a day. And if it doesn't start to reduce after the first 5 to 7 days, there could be some deep-rooted irritations or trigger points in those muscles that need a little bit more aggressive treatment. That's hard to do with just using a working lacrosse ball. We here at Integrated Health Solutions, our providers, we specialize in a technique called dry needling that actually uses a very fine filament that helps break up these tension areas in the muscle itself and provide an opportunity for the body to heal and to improve the function of that muscle afresh. It's a very powerful technique. So if you find yourself doing this and not quite getting the results you need, jump online to www.ihscindy.com and schedule an appointment to view with one of our providers today and get feeling better so that you can get back to doing those activities that you love doing. Once again, this is Dr. Sanders here at Integrated Health Solutions. Check out some of our other videos about tips about how to be better and feel better and function better at home. Thanks.